Fatty liver disease (FLD), also known as hepatic steatosis, is a condition where excess fat builds up in the liver. Often there are no or few symptoms. Occasionally there may be tiredness or pain in the upper right side of the abdomen. Complications may include cirrhosis, liver cancer, and esophageal varices. Fatty liver disease (FLD) is a condition where excess fat accumulates in the liver, affecting its function. It is increasingly common due to lifestyle factors, metabolic disorders, and excessive alcohol consumption. FLD can progress to severe liver damage if left unchecked. 1. Causes of fatty liver disease. Fatty liver disease is classified into two main types based on its cause: non-alcoholic fatty liver disease and AFLD. NAFLD is caused by factors other than alcohol consumption and is closely linked to metabolic disorders. Causes include obesity. Excess body weight increases fat deposition in the liver, insulin resistance, and type 2 diabetes. High blood sugar levels promote fat storage in the liver. Dyslipidemia, high cholesterol, and triglycerides contribute to fatty deposits in the liver. Sedentary lifestyle, lack of physical activity leads to fat accumulation. Poor diet, high consumption of refined sugars, processed foods, and unhealthy fats worsens liver fat accumulation. Polycystic ovary syndrome (PCOS). Hormonal imbalances in PCOS are linked to metabolic dysfunction and liver fat accumulation. Hypothyroidism, low thyroid hormone levels can slow metabolism and increase fat storage. B. Alcoholic fatty liver disease (AFLD). AFLD results from excessive alcohol consumption, which impairs fat metabolism and leads to liver fat accumulation. Chronic alcohol use can lead to inflammation, alcoholic hepatitis, and scarring cirrhosis. It is recommended that people with fatty liver disease do not drink alcohol. Treatment of NAFLD is generally otherwise by dietary changes and exercise to bring about weight loss. In those who are severely affected, liver transplantation may be an option. More than 90% of all heavy drinkers develop fatty liver, while about 25% develop the more severe alcoholic hepatitis. NAFLD affects about 30% of people in Western countries and 10% of people in Asia. NAFLD affects about 10% of children in the United States. It occurs more often in older people and males. 2. Signs and symptoms of fatty liver disease. Signs and symptoms. Often there are no or few symptoms. Occasionally there may be tiredness or pain in the upper right side of the abdomen. Complications: fatty liver can develop into a fibrosis or a liver cancer. For people affected by NAFLD, the 10-year survival rate was about 80%. The rate of progression of fibrosis in NASH is estimated to 1 per 7 years and 14 years for NAFLD. With an increasing speed, there is a strong relationship between these pathologies and metabolic illnesses. Diabetes type 2. Metabolic syndrome. These pathologies can also affect non-obese people, who are then at a higher risk. FLD is often silent in the early stages but can progress to more severe conditions. Common signs include early-stage simple steatosis or mild FLD, often asymptomatic, occasional fatigue or malaise, mild upper right abdominal discomfort, advanced stage non-alcoholic steatohepatitis, NASH or fibrosis, persistent fatigue, unexplained weight loss, abdominal pain or fullness, swelling, edema in legs and abdomen, ascites, yellowing of the skin and eyes, jaundice, itchy skin, enlarged liver or spleen felt during a physical exam. If untreated, fatty liver disease can progress to cirrhosis, which may lead to liver failure or liver cancer. 3. Prevention of fatty liver disease. Lifestyle modifications. 1. Maintain a healthy weight. Aim for a BMI within the normal range to reduce liver fat accumulation. 2. Exercise regularly. Engage in at least 150 minutes of moderate aerobic activity per week, for example, brisk walking, cycling, and strength training exercises. 3. Eat a balanced diet. Follow a Mediterranean diet rich in vegetables, whole grains, lean proteins, and healthy fats, for example, olive oil, nuts. For limit sugar and processed foods, reduce intake of sugary drinks, white bread, pastries, and high fructose corn syrup. 5. Increase fiber intake. Fiber-rich foods, fruits, vegetables, legumes improve gut and liver health. B. Alcohol and medication management. 1. Avoid excessive alcohol consumption. Limit intake to prevent alcohol-induced liver damage. 2. Be cautious with medications. Overuse of painkillers, acetaminophen, and certain supplements can harm the liver. C. Manage underlying conditions. 1. Control blood sugar levels. Proper management of diabetes reduces liver fat accumulation. 2. Lower cholesterol and triglycerides. Healthy diet, exercise, and medication, if necessary, can help maintain lipid balance. 3. Treat hormonal imbalances. Conditions like PCOS or hypothyroidism should be addressed. 4. Control and treatment of fatty liver disease. Diet-based strategies. Adopt a low-carb, high-fiber diet, reduce simple carbs, and prioritize fiber-rich foods. Consume liver-friendly foods. Green tea rich in antioxidants. Turmeric anti-inflammatory properties. Fatty fish omega-3 fatty acids. Coffee reduces liver enzyme levels. Limit saturated and trans fats. Avoid fried foods, processed meats, and excessive dairy fat. B. Exercise and weight loss. Losing 5 to 10% of body weight can significantly reduce liver fat. Incorporate both cardio and strength training. C. Medical interventions. No FDA-approved drugs specifically for NAFLD, but medications like metformin, vitamin E, and pioglitazone may be prescribed for associated conditions. If cirrhosis develops, liver transplantation may be the only option. Conclusion: fatty liver disease is a growing global health concern due to lifestyle changes and rising metabolic disorders. While often silent in early stages, it can lead to severe liver complications if left unmanaged. Prevention is key through healthy eating, regular exercise, weight control, and limiting alcohol intake. If diagnosed, timely lifestyle changes can halt or reverse the progression of the disease.
Thanks for watching. Like, subscribe, and turn on your bell notification for more.